today we will cover some commonly asked questions regarding sudden cardiac arrest. And also want to tell you that this month of October is celebrated as Cardiac Arrest Information Month all over the world. The sudden cardiac arrest most importantly occurs because of the coronary artery disease. That means that disease which causes a blockage in the heart arteries. This is by and large the most important reason for sudden cardiac arrest. Now, when we talk about cardiac arrest, usually what happens, the patient becomes suddenly unconscious. Now, few things which people should not do: never put any water or any fluid into the mouth of an unconscious patient, which is fundamentally wrong. Number one. Number two, if you can assess that whether a patient has a pulse or not, then the best way to see pulse is the carotid artery, here in the artery in the neck. If the pulse is palpable, then you really don't need to do CPR. The reason for unconsciousness may not be, in that patient, is not cardiac arrest. But many people may not be able to assess that. If you are not able to assess or understand whether there is a pulse or not, then you should assume that it is a cardiac arrest, and then you should do basically a cardiopulmonary resuscitation. Now, when we see any patient having cardiac arrest, and let's say he survives, either with the grace of God, or many times we give electric shock to the patient to revive him. Let's say we have revived him, then we have to assess that what is the heart disease which has caused the cardiac arrest. If this patient has any removable causes which we can treat it permanently, then these patients may not need, they may need the basic treatment of heart disease, like for example, if he has a blockage, we do the angioplasty or bypass surgery. And if we, after doing that procedure or treatment, and we think now the risk of sudden cardiac arrest is very minimal or not any existing anymore, then we don't need to do further treatment. But people, where we think people are at risk of sudden cardiac arrest, then we can give them a very implantable device which is done under local anesthesia. It is called ICD. And if I have to show you what is ICD, this is the kind of device, ICD. This device will come under the skin here, and a wire will go into the heart. And through this wire, this device will monitor the heart 24/7. And if a patient develops cardiac arrest, the device has the capability to diagnose it within less than 10 seconds or 12 seconds, and it can give an automatic shock. Now, the thing which I want to tell you, that who are those people who are at a risk of cardiac arrest? People where there is basically the heart has damage because of some previous heart attack or cardiomyopathy. If the ejection fraction means the pumping capacity of the heart is less than 35%, those people are the one who are at a high risk. So these patients should have an ICD, and ICD has been proven in multiple trials to be life-saver and very effective therapy for sudden cardiac arrest.